Welcome back. The global fight against COVID-19 is far from over. The government is banning all passenger flights from India and Pakistan as COVID-19 variants of concern spread across this country. India is seeing upticks of over 300,000 new cases a day and has one of the lowest vaccination rates in the G20. Canada lags behind some other countries in getting jabs in arms, while we were also in the middle of a deadly third wave here. Joining me now for more on the status of the pandemic internationally is Special Advisor to the Director General of the World Health Organization, Dr. Peter Singer. Dr. Singer, thank you so much for joining us today. We really appreciate you taking the time to be on the show. As we look around the world, it seems to be a very concerning situation when it comes to COVID-19. What is your greatest concern at the WHO right now? What is keeping you up at night?
Since the beginning of the pandemic, and Mercedes, thank you for having me. Since the beginning of the pandemic, WHO has fought day and night to end it. And the defining issue really for 2021 is vaccine equity.
And when you talk about vaccine equity, is your concern both within countries like Canada, but also countries like India or Brazil, where we're really seeing the variants taking on phenomenal and very frightening traction?
Yes, when we say vaccine equity, both within and among countries, but globally, Mercedes, almost 1 billion doses of vaccine have been distributed. 83% of those have gone to high-income countries and upper-middle-income countries. And there's a very, very inequitable distribution. And that means that the pandemic is raging in places, variants are being produced, and none of us is safe. And so it's very important to get vaccines around the world and to combine them, of course, with public health measures in the 1-2 punch to defeat the pandemic.
When it comes to that kind of distribution, the Canadian government took a lot of criticism for accepting vaccines out of a program that was designed to provide vaccines to lower income countries. Do you think that that's something the Trudeau government shouldn't have done?
The program you're talking about is the ACT Accelerator, the COVAX vaccine pillar, which, by the way, is celebrating its first anniversary this week. It has distributed more than 40 million doses of vaccine around the world. The Government of Canada has been a very active and positive participant financially and in terms of its engagement in the COVAX and in the ACT-A, and that's very much appreciated.
What do you think about Canada accessing vaccines out of that program, though, if the priority and the major concern is low-income countries who don't have the ability to buy millions of vaccines?
I think with vaccine equity, there's really 3 issues: dollars, doses, and domestic manufacturing. In terms of dollars, Canada's been a very good contributor. There's still a $19 billion shortfall in ACT-A, and that's compared to trillions of dollars of stimulus spending around the world. So that's a great buy. In terms of doses, it's very important actually for countries that have doses to share them. France recently announced that it would start sharing doses because it doesn't matter if you have money if you don't have vaccine doses to distribute. And then finally, vaccine manufacturing domestically, at least at the regional level, which is an issue for Canada and for every country around the world. For example, in the budget, there was money for domestic biomanufacturing in Canada, and that's an issue for every country around the world, including regionally in Africa, because ultimately self-reliance leads to interdependence and solidarity. And so domestic manufacturing in the mid to long term is just as important as dollars and doses.
When you look at the situation in Canada, and in particular in Ontario, where I know you used to reside, what is your description when you think about what's going on here? How do you see the situation in Canada?
It's the darkness before dawn. There's really no question that the situation in Canada is very tough, and many people are suffering. And this pandemic generally is the worst global public health crisis in 100 years. So it is a period of difficulty, but the dawn is coming. It's very important that hope is on the horizon. The vaccines are rolling out, combined with public health measures, means that this pandemic will end. And so that's the key thing, I think, for people to keep in mind, and for the time being, to make sure they maintain the public health measures, the masking, the physical distancing, avoiding poorly ventilated indoor spaces, and so on.
Is it advisable for countries to close their borders until the situation is under control?
That's a decision for national governments. WHO provides guidance under the international health regulations. The criteria are that those border closures be time-limited and risk-based.
Dr. Singer, that's all the time we have for today, but thank you so much for joining us. That's all the time we have for this week on the West Block. I'm Mercedes Stephenson. We'll see you right back here next week. In the meantime, stay safe and stay healthy.